Welcome back to Morning Break and this week's Monday Motivations brought to us by Gates Brain Health. We all know the man, Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician, joining us once again to talk about a common fibromyalgia. Is this considered a disease?
It's considered a condition. I wouldn't call it a disease, but it's definitely a condition.
That's what I wanted to ask you about. It's pretty common. I mean, we hear about fibromyalgia, but do people actually understand what that is?
I don't think so, and I think there's a big gap in understanding even in the mainstream healthcare circles and in patients. So fibromyalgia, the criteria has changed. It used to be individuals who had tenderness on palpation. We called it aldometry. And then now we classify an individual who has pain throughout their body, we say in 4 out of 5 regions. So think your arms, your legs, and your spine. So if you have chronic pain over 3 months in these regions, it's really severe. Basically, that's leading towards the diagnosis of fibro, and there are other associated symptoms, particularly fatigue is a huge one. Also associations to brain fog, insomnia, headaches, irritable bowel syndrome. So there are a number of other features to it.
I think you named about 4 or 5 of the diseases I have, just being, awake at 3 a.m. in the morning, but that's okay. And we were actually chatting off camera a little bit. Fibromyalgia used to kind of be this kind of, oh, you don't know what we have, so we have fibromyalgia. And you're saying it really is an actual condition.
It is, and sadly, that misunderstanding is still pervasive in a lot of healthcare circles. And one rheumatology textbook says, few conditions that evoke such ire as fibromyalgia amongst physicians. So there was a time where probably people who were seeking medications for pain would use the label of fibromyalgia, but fibromyalgia is very real, and there are a number of distinct underlying causes that we now know that are causing someone to have this clinical syndrome of
I was going to ask you, you listed symptoms, so if people say, I think I have some of those, what are the causes behind it?
Okay, so a huge finding came out, it really was in 2013 was the preprint, it got published in 2014, where they found that almost half of fibromyalgia patients have this condition called small fiber peripheral neuropathy. So your small fiber nerves are your pain nerves, and they were damaged, dying, or degenerating in half of fibromyalgia patients. But not many people know that, and it's a huge deal. So for a lot of people, fibromyalgia is a peripheral nerve condition, but they don't even know that.
Interesting.
Other causes, do you want me to go into those?
Yeah, absolutely.
Other causes include autoimmunity to the thyroid. So we're finding that this condition called Hashimoto's, where the immune system attacks the thyroid, irrespective of your thyroid blood test, so your thyroid hormone concentrations. If you have this immune attack on your thyroid, which can be tested via labs, then that can cause a syndrome that looks like fibromyalgia. The other biggie is childhood trauma. A really high proportion, it's upwards of 40% in some studies, of fibromyalgia patients have been exposed to childhood trauma of different forms, and that trauma that they experienced early in their life predisposes them to pain. We're even finding that if a mother has PTSD, that her child is more likely to experience chronic pain.
Very quickly, we're almost out of time, so I want to get to kind of 2 questions in at once. You guys actually have a treatment at Gates Brain Health, so I want to talk about that very quickly and some proactive steps people can take.
So our treatment's tailored to the individual. You can see that it's not just one cause, there are several causes, so let's get to the root of that individual's problem, co-manage if needed, but we work with that individual on their small fiber neuropathy, dietary issues, Hashimoto's, so on and so forth. What can they do? Watch my videos on fibromyalgia and stay persistent. Keep talking to your doctor. Don't just accept the eye roll and that you have fibro and you need to take XYZ medication.
Ask around, of course,
if you want to look for another,
and those videos can be found
on Gates Brain Health YouTube.
Wonderful. And very quickly, we have the symptoms popped up one more time for you that you can talk about. We have chronic widespread pain in your muscles, joints, fatigue, stiffness, headaches, depression, all sorts of things. If you have these issues, you can reach out to Gates Brain Health. Doctor, so much. It's always great to see you. Thank you so much.
Thank you, Rebecca. Appreciate it.
All right, we'll be right back.